iTind is a new device that we're trialling at the moment. It has come through preclinical trials very successfully. It's a small urethral prosthesis that we put in with a telescope under a general anesthetic. We leave it in for a week and then take it out. And the idea of the iTind is that it cuts through the prostate at the neck of the bladder and loosens this area. That then improves the urinary flow. And the promise of the iTind is that it can treat bladder neck obstruction, that is a poor flow, without causing retrograde ejaculation. It's particularly useful for the younger man, perhaps in his 40s, who may want to father children. iTind differs from, for example, UroLift in that the iTind goes in and comes out a week later, whereas the UroLift stays in permanently. I personally don't think UroLift is a very effective way of treating bladder neck obstruction, and that's why I've moved on to iTind. Other options for this condition would be medications known as alpha blockers, such as tamsulosin. They do cause retrograde ejaculation and they can cause giddiness and other side effects. Ultimately, in the younger man with a bladder neck problem, bladder neck incisional surgery is the most definitive treatment. However, there is a 25% risk of permanent retrograde ejaculation. Some men don't want that, and others, of course, want to have children and want to avoid retrograde. So I think iTind is showing potential, and we're evaluating it now with our patients, the first few of whom are very pleased with this procedure. The studies show that it's effective up to 5 years and maybe longer. We'll see as we continue to gain experience with it in the general community. There has recently been a rebate for iTind, so it's largely covered by private health insurance. Medical gaps are determined by the individual urologist office, and the patient should make inquiry before the implantation procedure. The iTind effect should be 5 years or more. Certainly that's the promise that it's showing. For the first week, there is considerable urethral discomfort because the prosthesis is in place, and men are advised to have a quiet week. Certainly they can work from home or in the office, but not be very physically active. Once the iTind comes out a week later, those symptoms abate.